Thank you for staying with us right here on Good Morning Kenya. And you know that each and every Tuesday is when we tackle health matters, and today is no different. We will be looking at diabetes. You know, diabetes, World Diabetes Day is celebrated on the 14th of November, but the entire month of November is on creating awareness on diabetes. And as we come to a close of this month, it is only right for us to get into this particular conversation. And today we will be looking on ways to manage this condition that is diabetes. And joining me for this particular conversation is on my far right, Dr. Priska Mungla, who is a consultant physician, diabetes specialist, and endocrinologist. And joining us as well is Brian Ekodere, and he is a person living with type 1 diabetes. If we may just get directly into it. Doc, welcome to the program. Brian, welcome to the program. If we may begin by you defining for us what diabetes is, for someone who's watching us at home to get to understand what exactly we are getting into.
Thank you so much, Vivian, for having us. And as you've rightly put it, November is World Diabetes Awareness Month. This month, our theme was Know Your Risk, Know Your Response. So I think this is a good forum for us to educate ourselves and to be able to empower ourselves. So for a start, diabetes is just a condition that the body has elevated blood sugar. And this can come about either because your body is not producing enough insulin. Insulin is an important hormone from the pancreas that helps regulate our blood sugar, especially when you've had a meal. So if you don't have insulin at all, then you'll have what we call type 1 diabetes. Then we have some who have insulin, but it is not enough. So it's a relative deficiency of insulin. Or you have enough insulin, but your body is not able to utilize it as much, especially in people we see who are overweight. And this gives us what we call type 2 diabetes. So for simple purposes of this educative talk, we'll mainly say that there are three entities of diabetes, which is type 1, type 2, and then a unique entity. Usually we see it in pregnancy, what we call gestational diabetes, which just comes because of all the hormones that the body produces, and most of the time they tend to recover after delivery.
Yeah.
Yes.
What are some of the causes, maybe?
So the causes will depend actually on the type of diabetes. Type 1 diabetes, because we know that the body does not have enough insulin, would come about from a mixture of genetic factors, and as well at times we see certain infections would predispose one to getting it. So you get the infection, then as your body is sort of fighting it, using your white blood cells, they accidentally see that the pancreas is equally a threat, then it will destroy the pancreas. Then now you have no insulin at all, then you get type 1 diabetes. Then for type 2 diabetes, that's where now there are things we can be able to control, because you have, of course, genetic component. That's why when you come for the consultation, some patients get bored when you ask them, is there anyone who has diabetes? But it's just to track and see if it's sort of genetic. So strong family history means both on your mother's side, your father's side, many of your uncles, aunties, you know, have diabetes is a risk. And
so
then
it can be hereditary?
It can be. But the main thing, especially for type 2, is lifestyle, where we are overweight, we are sedentary, we are not doing any physical activity. Some of the food choices that we take, we are drinking, we are smoking. Then you find also some medication that we use a lot, especially they are called steroids. We see them a lot in people who have asthma or arthritis, or even if you just go to some of these small chemists, they'll always tell you there's that blue pill they are given that makes all their problems go away, but in the long run you find that it brings us problems in terms of sugars. Yes. All right,
Brian, you are a person living with type 1 diabetes. Maybe when did the diagnosis happen?
I was diagnosed in 2016, mid-2016, where the symptoms were I was having a lot of feeling so thirsty, going to the washrooms every now and then I became so thin without trying. So I was actually around 70 kgs, and I actually went down to 50-something kgs in a span of 2 weeks. That was the main symptoms of type 1 diabetes that I had then. Then I went to the hospital. I was told I have type 1 diabetes, in which I had something called ketones. Maybe, Dr. you can actually elaborate more.
On that.
Then I was admitted for some 2 weeks, and then I started using insulin then till now.
Okay.
Yeah.
I just will give you the opportunity to elaborate ketones, what he just mentioned.
Okay, so remember, when we look at type 1 diabetes, it's just the fact that the body does not have any insulin at all. So your body is sort of starving in plenty. So your blood glucose is so high, but you're not able to utilize it at all. So you find that elevated blood sugar is what brings some of the symptoms that he had. That's the excessive thirst. With excessive thirst, you also urinate a lot, then you become dehydrated, then you also lose weight. The reason he lost weight is just because you have this elevated glucose that your body is not able to use, so it resorts to other mechanisms to survive. So you start breaking down your fat, then you'll break down your muscles, then that's how come you lose weight without trying. So when you break down this fat, the fat breakdown is what leads to what we call the ketone accumulation. This is just an alternative source of energy because your body literally wants to survive. So when these ketones become a lot, that's when now most of our patients with type 1 diabetes would present in an emergency setting, and that's how by their diagnosis is usually made. They are so sick, they are vomiting, they have nausea, they are unresponsive. Some even come in a coma, then they're admitted into the critical unit. So when you do their blood sugar, it's high. When you test what we call the ketones, they are high. That's when now quickly tells you this is a diabetic complication in someone who didn't know that they had diabetes. But the good thing is they do very well, as scary as it sounds. But with insulin, with fluids, you correct the electrolytes, they usually do very well.
Yeah, one would assume that diabetes is a condition that gets, or rather, people who are much older get this particular condition. So does age have anything to do with it? I mean, we can see Brian is not really an older person, you know, so does age have anything to do with it, or does it depend with the type of diabetes?
So age is arbitrary. So remember, age just tends to sort of classify to tell us which type of diabetes you have, but you can literally get diabetes at any age. It's just that we see what we call the type 1 diabetes in our younger population, and it can come at any age, even young children as young as months to years, but the peak tends to be, we have 2 peaks, when they are around 7, 8, and then again when they're in their teens, they're like 15, 16. But we also have a unique subset of patients with type 1 diabetes that we see when they're slightly older, between 30 and 40. And it usually brings a little bit of confusion, because if you just use age, you can easily label them as a type 2. You start them on type 2 medication, but they don't respond until you revert back to insulin. But for general classification, people try to say that type 1 is seen in the younger population and type 2 in the older population. That's usually above 45. But for us, age these days is not a real determinant on whether you'll get diabetes or not. Yeah, it's more of the risk factors.
All right. And before we get into the risk factors, he mentioned his symptoms, the ones that he got to witness, you know, the ones that he got to encounter rather. What are maybe some other symptoms to diabetes? So
other than the ones he mentioned, the excessive thirst, excessive urination, unintentional, and it has to be unintentional weight loss, which means that you're not on a diet or you're not doing any extreme exercise. Then at times you find some people are recurrent infections. In ladies, you'd find that you get a yeast. So you find you have multiple infections. In fact, at times we see some people have domestic issues because some people think yeast is an STI. Then you're looking at your husband, you know, badly, but it's not really the case. So if you get more than that, or recurrent urinary infections, or even have wounds that don't heal, Some men even just come and their main presentation is they have erectile dysfunction, and that's their only presentation. So you find they're noticing that bedroom matters, things are not going on very well. Then they wonder, then we find they have sugar issues. Some people, it's even just vision changes. You go to the optician that, you feel like your eyes, you're not seeing well, you want glasses. In fact, these days we thank God that our ophthalmologist or eye specialist, in fact, if you go, they'll check your sugar, blood pressure first, because at times that's where the problem is. So you find you just have either blood vision or lenses are not clear. Then some people even have issues relating to fatigue, memory, you feel depressed most of the time, just lack of energy. So at times diabetes can have very non-specific symptoms. So that's why we usually say is learn to listen to the body, see what is normal and what is out of the ordinary, and a simple sugar prick can change your life. And remember, with children, they won't be able to tell you some of these symptoms. So it is you as the mom to be a little alert. If they're asking you for more water than usual, you should know what their usual is. Then you investigate. Or if all of a sudden they don't want to play with the other children, they are tired, or someone you had already potty trained is wetting the bed, that should tell you that their urge to urinate is more, until they have accidents more than they should. So we listen to our body. Walk in for any chemist anywhere, you can easily get a sugar prick. Even you right now, Vivian, you look normal, but we tell you to get a sugar check, just to at least know what your baseline is, because majority of the patients with diabetes are asymptomatic, which means they do not have any symptoms. Yes.
For Brian, are you on daily medication?
Yes, I'm on daily medication. I'm on insulin. I use at least 3 times in a day. That's before meals, and 1 insulin just before bedtime. That's how I manage my sugars, through insulin, diet, and a bit of just knowing your body. As the doctor said, sometimes you have to listen to your body, know how your body reacts to daily approach in life, and just to be aware of the situations that you're in. But majorly or mostly I use insulin to manage my blood sugars.
And maybe how has this condition affected your day-to-day life?
Initially it was really hard for me, because as a young person, you have to fit in the society, trying to be normal, acting normal as always. But there's a lot of stigma in terms of diabetes, especially type 1, in terms of I was diagnosed when I was early 20s, around 21 years of age. It was really hard because there's a lot of stigma nowadays in terms of mostly in campuses, in colleges, in schools. It affected me more so on that side. But as the years were going by, I decided to learn and to take charge of my health and to be responsible of whatever things that I do. And after that, my life has been easy and positivity all the way.
Positivity all the way. I love that. I love that for you. Now, Doc, according to statistics, it shows that Kenya has a prevalence of 460 diabetic cases per 10,000 population. This is an increase. Maybe what is causing the increase in diabetes cases in the country?
So remember, this is data that shows that our prevalence is usually around 3.7%. But remember, as a country, we've also failed because we don't have enough data. I feel it's even more than that. And the reason we even need to worry is even projections by IDF project that in the next, by 2045, that number is even going to double and triple.
Around 5 points.
Almost 5-6%. And it is estimated that diabetes and obesity is going to be our next pandemic, like in the next decade or so. And the reason that has also skyrocketed is the reality is our lifestyle has really changed. If you look around how our parents were living, how we were living has changed. These days, every corner you look around, there's fast food. I'm sure if we snoop into your phone right now, You may have ordered something, last night, and it's okay, because also life is really busy. But the problem is our diet has changed. We are eating more fast food, the junk food to appease ourselves, our children on Sunday. Those are our treats. They are everywhere. There are so many apps. They are cheap. There are offers.
Yeah.
But also we are not doing exercise. So we are really sedentary. Even to move from here to, my office, I'll drive.
Yeah.
Or you'll take a motorbike. So the less we are doing some of the physical activities, the problem. And also we are drinking more, we are smoking more. So it's more of our lifestyle change. And we've copied most of the things that we used to see in the West. So if we take a step back and just look back to how our parents, our grandparents lived, I think that's where we'll be able to cap that. Because if we eat some of the foods they used to eat, which are more of the organic things, and that's what the West is doing. The West people have moved to organic, produce. Everything should be organic, certified. So if we start shifting towards that, then I think we'll be able to nip that in the bud. Yes.
It is estimated that 44% of diabetes cases are undiagnosed.
Yes.
Why is this the case?
Remember I told you that majority of people who have diabetes are asymptomatic.
Yeah.
Yes. So that's why if you don't have any symptoms, you'll have no business getting your, yes. But remember, you still have the risk factors that we've talked about. So it's just simmering. And what usually happens is by the time type 1 diabetes is straightforward, because when your body doesn't have insulin, it will shut down immediately. But type 2 is a progressive illness. So you find that you move from normal sugars to a period of abnormal sugars before you reach diabetes. So this period of abnormal sugars to diabetes, remember the sugars are already slightly higher than they should. You won't have much of a problem unless you accidentally get your sugars checked. So here to this transition is where the secret lies. And even by the time you're diagnosed with diabetes, this is type 2 diabetes, you've had abnormal sugars for usually almost 5-10 years prior to that. That is why there's a huge chunk of people undiagnosed. And that's why even by the time we diagnose you with type 2 diabetes, some of the complications have started setting in. That's why you'll be diagnosed and your doctor will send you for a battery of tests. You'll wonder why. It's because now you want to start looking backwards to see which of the organs have been affected as you tailor-make your treatment. So what we usually educate our patients is on months like this, that everyone and the hype is about diabetes, this is the time for you to be curious. Yes. And don't just look at it that, I look skinny, I might get away with it. No. Just walk in, get your blood sugar checked. It can actually change your life. Because if we find you in what we call the pre-diabetes stage, with intense lifestyle interventions, we can push you back to sort of be normal. So it's all about curiosity and awareness. Yes.
All right, let's take a break and then we'll be back in a moment. Welcome back and thank you for joining us. Now, before we took that break, you were just talking to us about the number of undetected cases of diabetes. And my question is, are there complications that come with someone not being detected earlier? You had mentioned some of them, but just what are some of the complications that come with someone who hasn't been detected really earlier on?
Okay. So remember, diabetes can literally affect any part of your body, but some of the organs we really worry about are our vital organs. So it can affect your eyes, vision. It's actually, I think, the second leading cause of vision impairment and vision loss. So the eyes, even in the mouth, we have people who get recurrent infections, recurrent dental caries, tooth loss, inflammation. Then we come to the heart, leading cause of heart attack and heart failure. Then we come to the kidneys, leading cause again of kidney kidney failure leading to dialysis, which is also very expensive, or at times if your kidneys have failed, you have to get a transplant, and that's the time you realize even your people might not donate for you a kidney when you really need it. So kidney, then again, when we go down to the nerves and the feet, you find that that's where again we find most leading cause of amputations, which is not traumatic like due to an accident, because they get recurrent wounds then that don't heal very well. Then also the blood supply to the leg is impaired. Then you find they get amputations. And I have patients who actually have been amputated both sides. So you can imagine you're young, you've lost both legs. How are you supposed to earn a living? Adaptation is difficult. Then also things like strokes. Then now even mentally, it's the leading cause of things like depression, anxiety, as even he was telling us about how the stigma he got initially. So you find that it can really put you in a state of now you're depressed, withdrawn, because you're young, you want to live your life, and here you are trying to inject your insulin, trying to measure what you eat and all that. So remember, diabetes can literally affect any part of the body. Yes. Okay.
Brian, are there triggers that maybe worsen the condition?
There wasn't any trigger. With type 1, just the body just attacks itself. They're called beta cells. That's why when we get the symptoms, but there wasn't any trigger that caused the diabetes type 1. Yeah.
What's the hardest part in managing diabetes, according to you, for someone who's living with type 1?
Stigma, that's the first one. Carbohydrates counting, because we need to eat each and every time, most of the time. And insulin injection I don't consider it as a challenge to me, but stigma is the main one, which, as I said, really affects young people, especially in schools and wherever they are. And with me and some other young people, that we came up with an organization called the Young and Sweet team. We have a podcast that we try to educate to people, especially the young guys, on how to live positively, live normal, because as an individual you have to take charge of your health so that you cannot have the complications of diabetes. So we also have a support group that any other person that has type 1 that needs to maybe have emotional support, physical support, they can join us through Twitter, Facebook, Instagram, WhatsApp and YouTube, so that they can come together. And with numbers, there's a lot of sense of getting to know yourself better, getting to know the risks, and learning from the others on how to manage type 1.
Doc, is there a correlation between diabetes and blood pressure?
They are just like what we'd call fraternal twins. There's no direct relation, but usually when you find one, the other is just literally lacking in the shadows. So most of our patients with diabetes would get blood pressure. Then also our patients with blood pressure or hypertension, we tend to screen them a lot for diabetes, because it would just sort of recur. But there's no direct relation, but they are both risks for the other.
Are you able to manage to monitor rather your blood sugar levels? Do you get to a point where you can tell, I feel like my blood sugar levels are low?
Yeah, there is some symptoms of hypoglycemia. Most of the time you have headache and you have shaky hands, you sweat a lot. Those are the main symptoms of having low blood sugar. And the best way to check if you have low blood sugar is to use the glucometer, or some people do have the continuous glucose monitor system. Those are the machines that you use to monitor your blood sugar. But the symptoms, having a shaky feeling in your body, maybe increased heartbeat, and having some incidents of sweats in your body.
For someone maybe who has a friend or has a family member who's living with type 1 diabetes, or maybe even type 2 diabetes, what word do you have for them?
As I said earlier, positivity. Something sits beyond you. And take charge of your health, be positive, and above all, we're here to show people that you can live positively and wholesomely with type 1 diabetes. It's really challenging for your relatives or somebody that cares about you to know that maybe you are struggling with diabetes, but it's up to you. 70% it's your initiative to control your diabetes. So take charge of your health, be positive, and make use of the doctors as well, because without them, of course, we couldn't be maybe this healthy or knowing our risks, as the theme for this year is know your risk and know your response. With the doctors, with the patients, and with the caregivers and the people that you care about, when you all come together, it's a win-win for all. Yeah.
Is it curable, Doc? Is diabetes curable?
So first, type 1, no. Yes, so type 1, you'll use insulin for the rest of your life. Type 2, we aim for control. Control just means that your sugars turn back to normal, within the normal range, and to minimize complications. But there is a subset of patients in whom you're able to reach what we call diabetes remission, which just means that you've controlled their sugars so well through diet, lifestyle, exercise, medication, until they don't need it anymore. But that's a very small population, and you need to talk to your doctor first if you're able to reach that one, so that you set realistic targets and if it's possible for you. But even if you reach remission, you'll still need to be followed up, because it can always come back. But our goals for treatment for diabetes remain normalizing your sugar, preventing or reducing your risks of complications, so that you live a normal and healthy life as much as possible.
As we wind up on this conversation, what foods are we avoiding?
So avoiding is a strong term.
Or should we minimize?
So we aim for portions, and the main thing that we really aim to control are usually your carbs, because that's what would really spike your sugars so much. And usually we say we switch it, not avoid completely, but switch the refined carbs for sort of the whole grain, which are our brown options, which at times are not very tasty, but that's what you go for. And then cut out on all of this fast food, the junk food, the refined foods, the cakes, mandazis, all that. Try and live a very healthy life. So for a parting shot, we just say, if you're going to eat on your plate, half your plate should be vegetables, and it's whichever vegetables you have. Then this other half is what we divide it again, and then that's almost a quarter of that. A quarter is your carbohydrates, whole grain, whole natural most of the time, and then this other one should be your proteins, which you intermix between plant proteins and animal proteins as need be. But also we tend to work closely with a nutritionist, because not all patients are the same. Patients have different requirements, needs, and even as Brian has said, type 1 is even more complex. We teach them how to count everything that they are eating. So I think maybe another session we would have with a nutritionist, and we'd really just emphasize on diet, because that one is a whole new chapter that would be really beneficial, I think, to everyone.
Would you say your lifestyle has changed in terms of what you eat?
It must.
How much you exercise?
Yeah. Generally, it has changed, because I'm so aware of my health right now. I do a lot of exercise, mostly in the morning or maybe in the evening. With diet, as Doc has said, there's something called carb counting, because with the insulin that I inject in my body, it has to be almost the same portions with the carbohydrates intake. If I decide not to eat carbohydrates, sometimes I don't need to inject insulin if I decide I'm not using carbohydrates for that particular time or day. But more so with testing your sugars, that's the most important thing, because before eating I have to test my sugar so that I can know how much insulin I'll use or how much carbohydrates I'll take for that particular session of eating.
Parting shots. As we finish this conversation.
I think know your risk, know your response, which means let's all take the initiative, let's get tested, let's know where we stand in terms of the sugar spectrum. Yes.
Your parting shot?
Be bold. Life is more than just diabetes, because you never know.
All right, and this is where we end this conversation on managing diabetes. I am sure that you have learned a thing or two, because myself, I know that I have learned. And one thing I'm taking home from this is that not after this, I may be lying, but I will make sure that I go and get my blood sugar checked. Let's make it a point to just go have ourselves checked. You don't need to have any symptoms, because as the doctor has just told us, that not all patients get symptoms. There are those that are asymptomatic. So just to make to make your life better, you know, and to even reduce your risks because of the complications that we've had that come with someone not being detected earlier, let's just go get checked. It won't cost us much. My name is Vivian Degwa, and on behalf of the entire Good Morning Kenya team, I want to wish you a lovely day. Do enjoy the rest of your viewing.